There is a shocking new statistic about what causes most personal bankruptcies in this nation. It has nothing to do with the stock market or job losses. Instead, medical bills are the reason nearly 2/3 of the time. Here's CBS News correspondent Hattie Kauffman.
Medical bills from her breast cancer and his open heart surgery nearly cost Mary McKernan and her husband Ron their home.
I had breast cancer.
I had a triple bypass.
The couple's insurer refused to pay for many of the treatments. Only 10% of Ron's hospitalization was covered. Overwhelmed by bills, they filed for bankruptcy.
We owed about $200,000 at that point.
The McKernans are hardly alone. Families who fall into bankruptcy often think they're covered, they have health insurance, but all it takes is one catastrophic illness to push them over the edge. A new study published in the American Journal of Medicine finds 62% of all personal bankruptcies were caused by medical bills, an astounding increase from just 8% a generation ago. Ron and Mary are among the 75% who declared bankruptcy despite having health insurance. According to the study, out-of-pocket expenses can average $22,000 a year for heart disease patients like Ron.
This seems unfair. This seems like it just didn't have to be this way.
Hattie Kauffman, CBS News, Los Angeles.
Joining us now from Boston is Health and Human Services Secretary Kathleen Sebelius. Madam Secretary, good morning.
Good morning, Harry. How are you?
I'm well, but it's certainly a lot of people in this country are not well. Certain
That's right.
conditions like heart disease, MS, the out-of-pocket expenses run into the tens of thousands of dollars. Will health care reform prevent these kinds of economic catastrophes?
Well, I think whether it's the couple that we just saw, Mary and Ron, or thousands and thousands of Americans are really struggling, even if they have insurance, with what we call underinsurance, where out-of-pocket expenses and health costs are just crushing families and businesses. That's why President Obama is so focused on health reform this year, lowering costs for those who have coverage already so that we can keep the coverage we have, keep the doctors we have, but also to provide some coverage and some payment for the millions of Americans, close to 50 million, who have no insurance coverage at all. And those of us with insurance are paying that bill also.
We'll talk for a second there about the 47 million people who don't have any insurance. As health reform comes closer, as this becomes, you're ready to unveil it, are we any closer to understanding, is this a single payer? What form will this really take?
Well, I think that the discussion that Congress is actively engaged in a very bipartisan way is to create a health exchange, to create really a marketplace where you would have a public option side by side with private plans, and folks without insurance coverage or who may have coverage that is inadequate or not covering what they need to cover would have a choice. For Americans who have coverage they'd keep their doctor, they'd keep their coverage, will help employers move forward. But for others, they'd finally have a choice, and we'll have some competition in the market, which will lower costs overall.
I've got 15 seconds or so left. Some people say this is so broken, we can't afford not to fix it. It may be too expensive to fix, with a price tag of more than $1 trillion. Are we stuck between a rock and a hard place?
Well, I think health reform helps to lower costs overall. That's really what the focus is. If we can drive toward health and wellness, make sure that people intervene early and get the right care at the right time, overall costs will come down.
All right. Kathleen Sebelius, Secretary Kathleen Sebelius, we gave you a medical degree just overnight. There you go. Thank you so much for taking the time to speak with us.
Thank you. Good to be with you.